In today's day and age, if you look around, everything is changing at a rapid speed. If you ask anyone who has been doing clinical dentistry for the last 10-15 years, they will tell you about the shift that has taken place in dentistry. Continuously, there are things which are changing, technologies which are being developed, and methods which are shifting from one end to the other. So, to stay updated, we need to keep on learning and relearning what we know. For that, we need to attend continuing dental education programs or CDEs. In the last 4 to 5 years, there has been a mushrooming of a large amount of CDE program providers. It becomes tough for us to decide which is the right one we should attend and from which we will gain the maximum benefit. So in today's video, we are going to discuss the 7 steps that you need to follow to identify the best CDE program for you and how to make the best use out of it. Stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our motto here is to help dentists succeed. Today, we are going to talk about the 7 steps you need to follow to select the ideal continuing dental education or CDE program for yourself. So step number 1 is knowing your current situation. For example, you're a freshly passed out dentist. You have done a few cases of root canal in college, but you're not extremely confident about it. What you need to do is, you need to go and attend a course where they teach you the basics of endodontics. Maybe it can be supplemented with an understanding of how to go about rotary endodontics. But it wouldn't make sense for you to go and attend a course where they teach file retrieval, where they teach endomicroscopy, when you are not confident about the basics. Now, if you are in an age group of 5 to 6 years into practice, then you would be confident about the basic procedures like composite restorations, basic root canals. At that point of time, you have to see what is the next ideal step for you. What are the patients around you requesting for? It might be the patients around you who require full mouth rehab, or they would be asking for replacement options like implants, advanced surgeries. So when you're 5 to 6 years into practice, you can go in for CDE programs which enable you to take your practice into the next level. So the point number 1 or the first step which you need to follow is understanding your current situation. So the second step is to ask around and search online. What you need to do is to go through the various Facebook groups in which you would see various lectures being continuously posted about. You need to make a list of the speakers who speak on the particular topic which you are interested in. You can also approach seniors and colleagues who might have attended similar courses. Ask them for their views and opinions on the courses which they have attended. Once you make this list, you move on to the third step. That is, you research about the mentor or the speaker. You have to see what kind of lectures do they take. As in, is it only lecture based? Is it lecture and hands-on? Is there a lecture and demo? Is there a live patient demo? All these things need to be taken into consideration. So knowing about the speaker or the mentor is extremely important. Fourth step you need to consider is the course duration. If it is a 4-hour course, the mentor, however knowledgeable they are, can only get into the introduction of a topic. If it is a 1-day course, they can go in slightly more depth where they could have something as a hands-on or a live patient demo. It is when the course is of 2 to 3 days where complete in-depth transfer of knowledge can occur. Depending upon what you are looking out of the CDE, you should select either a half-day course, a full-day course, or a 2 to 3 duration course. If you are a beginner, going in for a half-day or a full-day course makes sense so that you understand what are you learning about. However, if you are already doing it routinely but want to upgrade your knowledge, going in for a course of 2 to 3 days duration makes more sense. Moving on to the step number 5. Once you have decided on the speaker you want to attend, what you need to do is you need to analyze the cost. The same speaker may speak across various forums and the charges might vary substantially. That depends upon the organizers, where it is being held, and how much duration it is for. So based on the cost, you can decide which makes more financial sense to you. When you are considering the cost, even consider if there is any travel involved. Is it outside your town or your city where you are staying? So is there stay going to be included? How much is the overall expenditure which you are expecting to attend the particular course? Now moving to step number 6, that is post-course support. We have seen a lot of speakers and organizations are extremely enthusiastic to support the people who have attended their courses even after the course is over. There are WhatsApp groups which are made where once you start using those kind of treatments which have been taught, you can ask your doubts which would be answered by the mentor. Such kind of interaction helps you boost your confidence. So find for courses where there is post-course support. The 7th step you need to do is implementation. Remember, knowledge which is not used is no knowledge at all. Once you learn something, you need to apply it. I know of a few CDE addicts or CDE junkies. They attend one course after the other, but they never implement it. Don't get into that rut. Soon as you attend a continuing dental education course, see that you apply the knowledge as soon as possible. The more the duration between learning and application, that much amount of knowledge you tend to forget. So see that you implement what you learn. So the 7 steps that we have discussed to identify and make the best use of the CDE programs you attend are: number 1, understand your current position. Number 2, ask around, search online. Number 3, research the mentor or speaker. Number 4, analyze the course duration and course details. Number 5, look into the cost. Number 6, post-course whether there is a feedback mechanism or support. And number 7, implementation of what you learned. If you like this video, click the like button below, subscribe to our channel and click the bell icon. So whenever we post such videos, it will come in handy for you. And do not forget to share these videos with others. The question for today is, which out of the 7 points you think we usually make a mistake in? Do we make a mistake in identifying the correct mentor? Do we make a mistake in selecting the correct course duration? What is the basic flaw we all tend to do when selecting a CDE? I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim is to help dentists succeed. Thank you.